Social prescribing is a service that supports people and links people in with different activities and groups within the community.
The main value is all about the time that us as link workers have to spend with them. So we have time to build up a relationship with somebody first of all, to take them where they're at. You know, we can explore possibilities with them. So we can talk about things that are possible in their area, but we can do that over time. Like, it's not like we only have 5 minutes and then next patient kind of stuff, do you know what I mean? So we can spend an hour and a half, 2 hours if necessary, help somebody relax, get to know each other first of all, and build up a kind of a relationship, a rapport, maybe a level of trust. And then through those chats, then we can kind of get an idea of the kind of things that they might like to do.
Different health sectors or services within the HSE, they're meeting individuals all the time and they're addressing very specific needs, I suppose, in terms of the patients or clients that they're meeting. But through their interactions, they may notice or have a conversation with an individual where they identify that this person could do with other supports within the community or other supports that are available outside of the clinical setting. And social prescribing link workers can dedicate time then that maybe healthcare professionals don't have to support an individual or a person to access the different services and agencies.
If we can hold somebody's hand, for want of a better expression, go along with them and have that kind of, almost help them get their foot in the door. You know, whereas if I was just to pass somebody on, there's a name and a number and they meet in the library, a lot of people might get to the library but they wouldn't get inside the door of the library at 8 o'clock on a Tuesday. You know, but if I'm meeting them there because I've built up a relationship with them and they trust me a bit now, then they'll go with me. And if I can spend that hour with them or that 2 hours with them the first night, maybe the second night, maybe the third night they can go on their own.
People can be referred from lots of different agencies or from medical professionals. So the GP might make a referral, or the dietitian or public health nurse, or a family resource centre might make a referral, or somebody can pick up a leaflet in the local health centre or library and think that maybe this is a service for them, and so that they can self-refer at that stage.
A man in particular who would have survived a stroke a little over a year ago, both he and his wife had been struggling with how he was dealing with it. How it's benefited both of them is that it's given them an idea that there are services there for them, and that there are specific services that work with people who are living with a long-term health condition. So there's a number of things. So he's linking in with other people who know what he's talking about for a start, because they have a long-term health condition as well. He's also linked in with a men's group who have a gardening project side to the group. So it's a skill that he loves, that he's immersed in. They always knew that there was help, but they just didn't know how to contact that help, or exactly how much help was there, where it was, who the person was. So they've linked in with other services, the likes of Grow and Shine and Aware, who run programs and run groups that support people with long-term issues and conditions.
So the link worker has a good knowledge of what is out there and what's available. When an individual comes to the social prescribing service then and has the chat with the link worker, it's easier for the link worker to know this might be something that would suit this individual, and we can have the discussion, and the link then is made between the individual and the service.
So when you go for medical appointments, any kind of medical, it's always about, okay, what's the problem, what's wrong? We all talk about what matters to you. So what gets you out of bed in the morning? What gives you a bit of go, a bit of drive? What would be something that would encourage you to get out of the house and to meet other people? So all of the plans, the discussions, the suggestions are all based on what matters to you.